And the other disadvantage is that you have to increase patient days. Okay, because there's going to be more absorption, you're going to lose some of the density, and so you have to increase technical factors, and so the patient dose increases. Okay, and so here we go. So this is the idea. You have primary radiation coming down, and if this was a perfect setting, you will have X-rays just going right through it, right? But it doesn't work that way. Some of them will hit these lines, and they will be absorbing. You'll end up with grid lines. Also, another problem, the scatter radiation that is created, because it goes in all, it takes different angles. Some of them are not going to go, are going to come this way, and they're going to be absorbed by the lead lines. Make sense? Right, so that's the purpose of it, is to clean up some of this scatter radiation that otherwise, if you leave it alone, if you don't do anything, it doesn't matter how much collimation you have or how thin the patient is, you're going to have scatter radiation. Okay? And so that's why the grids. All right. All right, so what is the Potter-Bucky diaphragm? The Potter-Bucky diaphragm is the full name for the Bucky. Okay? That's what it's called, Potter-Bucky grid or Potter-Bucky diaphragm. And it's in honor of Dr. Hollis Potter, okay? And he made great improvements to grids, okay? Remember, Bucky had developed grids. You know, he invented grids. But Hollis Potter made improvements to it, to the grid, all right? So what he did, and instead of having, remember last time when I was describing what Bucky had done, I said that grids were cross-hatch grids. Like this, right? Mm-hmm. Yes. All right. And so what Potter did is he said, well, we don't really need to have lines in this direction. How come? Let's just make grids in one direction. Let's just make grids like this, okay? And is the advantage of a grid like this is now when you have a crosshatch grid, then you have to be perfectly centered at the perfect distance and one slight angle on your tube, either in this direction, look at my hand, otherwise you're gonna get lost. This direction or this direction or this direction or this direction. With a crosshatch grid, you're gonna have grid cutoff. What is grid cutoff? You have
white lines.
No, no white lines. You're gonna have an area that is going to have more density than another area. Okay? Okay? With this type, and if you can look this way again for a second. With this type, it just lines going in one direction. You have to be, you can angle this way. Look at me. You can angle this way, but you cannot angle this way. Because then you get grid cut off. Make sense? Mm-hmm. And so it's easier to work with grids that have this design. They give you a little more flexibility. Okay? So that's what he did. So he realigned lead strips to run in one direction. And then the other thing that he did is move grid during the exposure. Lines were invisible. That was pretty cool. Okay, remember we had talked about grid lines? And so what Potter did is he designed a mechanism that it will move the Bucky while you're making the exposure to go. While you're making, remember I showed it to you with that machine last year? I did. You did. I know I did. If you forgot, no, I did. And so the Bucky, okay, the Bucky moves when you make an exposure. Have you ever heard patients saying, oh, this thing shakes when you make exposures? They will. Because that's what happens. And it feels like it's shaking. It feels like you have an earthquake or whatever. But the table, when you make the exposure, the table moves. And that's what it's doing, is the Potter-Bucky grid is moving. Okay? When you do that, when it's moving, okay, lines disappear. You don't have those grid lines there anymore. Okay, they're gone. Okay? All right, now the motion Okay, this is important. The motion of the Potter bucket grid has to be at the same exposure. It has to move with less or at the exposure time that you're using. If it's taking longer than your exposure, then you're going to have motion. Make sense? And so there are grids, especially the older type grids, they don't work well with new equipment, because new equipment you can use 1 millisecond exposure. You're not going to have, we're going to see some of the old designs use it like a crank with a spring. I mean, they are not going to move at 1 millisecond. Okay, so you need electronic grids that really move up 1 millisecond. Are you following me? Mm-hmm. If the bottom line, if the Potter bucket grid moves too slow, you're going to have motion, and you don't want that. You eliminate the lines where you have motion, so it needs to move pretty fast. It needs to move when you make the exposure, so you can get rid of the grid lines and no motion.
Okay.
All right. Okay.
Do they use the motion in digital? Or is it just
That's
software?
a good question. He's asking if they're used the motion with digital. Most digital systems are not using the motion anymore, because you can have algorithms that can get rid of the lines. You know, our system, you don't have our system shaking, because it's not a Potter bucket grid. It's a grid, but it's not a Potter bucket grid. It doesn't move. We don't need to. Those two machines. This one does, but those two, they don't, because the algorithm, when you process the image, will take care of it. So you don't see grid lines when you do the image. Okay. And even, I'm gonna invite a former student. She graduated a couple years ago, 3 years ago. They are using, at the hospital she's working in Sacramento, they just bought a new system. I think it's a Philips, I'm not sure. She sent me the paperwork, I forgot. And what it is they call it a digital grid. Okay, it's really not a grid. What it is an algorithm that can clean up scatter radiation. It can recognize the way she described it is this system can recognize the intensity of the beam, the intensity of the scatter compared to primary beam, and so they can get rid, mathematically, they can get rid of the scatter radiation. The FDA has approved it for abdomen, for chest and abdomen, so not for pelvis yet. I think it's coming up. And so, in this case, no grid anymore. No grid. It's just the algorithm they use to clean up the image. That makes sense? Mm-hmm. Okay. So, but like I said, it's something really new. But for the most part, you know, DR, CR, they still use grids, but they don't move. All right, so let's go to grid dimensions now. Okay, so H here, it stands for the height of the radio peg strips. So here, okay, this is H. D is the distance between the lead strips. Okay, here. And so it's the thickness of the interspace material. Whatever you place in here, okay, that's D. And this is going to be useful when we study grid ratios. Grid ratio is the height of the lead strip divided by the thickness of the interspace material, or the spacing between lead grids. Pretty straightforward, right? Mm-hmm. Okay, so let's take a look at grid ratio. And let me say one thing. It's important to understand about grid ratio because it will tell you the ability of the grid to clean out the scatter radiation. Let me say it again. The grid ratio is going to tell you the ability of the grid to clean out the scatter radiation. The higher the ratio, the more cleanup it can do. This is an important fact. If you look at any grid, doesn't matter what type of grid you're looking at, on the back of any grid, you know, unless they rip it, on the back of any grid, this is one of the things that is going to be shown to you. Okay, it's right here. This grid, for example, is saying is an 8-to-1 grid, and okay, so here's the ratio, 8-to-1. okay? You have 6 to 1s, you have 12 to 1s, and so the higher the ratio grid, the more cleanup you can do. However, the higher the ratio grid, the more patient dose, okay? And so it is an important data that is found here. All right, so the ratio, when we think of the ratio, all right, you have to be careful because, let me show you again. Higher ratio grid are more efficient in removing a scatter, I told you that. They are more expensive, they are hard to build, they're hard to create, okay? I mean, you're talking, in this case, for example, take a look, in this case, you have an 8 to 1 grid, meaning that you have 8 lines per centimeter. Okay, 8 of these lines per centimeter, a centimeter is like this, guys. Okay, and you have 8 lines lead with interface material, so they are difficult to manufacture. They are not easy to manufacture. So they are expensive. You're talking, a cheap grid is probably about $900. They are expensive, okay? And the higher the ratio and the higher something else, we're gonna look in just a second, the higher the frequency, the more expensive they become, okay? And so, so that's so you know. All right, higher patient exposure. All right, now take a look at this. This grid, for example, even though they have the same, the width or the spacing between lead strips is the same as this one has double the ratio because they have increased the height. Because think, the purpose of the lead strip here is to absorb scatter radiation, right? And the taller, okay, and when I say taller, I'm talking what is being shown here is not the grid like this. This is not what you're seeing. That's it. You're seeing it like this. It's a cross section of it. And so the lines are there, or in this case, like this. Make sense? And so in 1 centimeter, you're gonna split 2 of this. And so when I said the taller this is, I'm talking the thickness of this grid. Okay? Is that clear? Mm-hmm. All right. And so the thicker you're making it, then the more lead you have, right? And the greater the chance for scatter radiation to be absorbed. Make sense? Mm-hmm. All right. All right, typical ratio grids. They can go, the range is typical for diagnostic radiography. You're gonna go from about 5 to about 16. 5 to 1s to 16 to 1s. The most commons are probably 6 to 1s and 8 to 1s. That's what you typically see in diagnostic radiography. But the 10 to 1s, 12 to 1s are common, but not as common as 8 to 1s. Okay? And remember, once again, the higher the ratio grid, okay, the more cleanup you have. Okay, but the higher the patient dose. Make sense? Okay, all right. So this is what you have. So with low ratio grids, it's easier for both primary and the scatter radiation to go right through it. It's easier. With high ratio grids, you're going to have, yes, you have more absorption of the scatter radiation, but also more absorption of primary beam. Okay? Yes? Okay, good. All right. All right, let me give you a grid ratio example. If a grid has an interspace material of 0.5 millimeters and a lead strips that are 3 millimeter high, what is the ratio grid? Okay, very simple, right? So you have 3 divided by 0.5 and the ratio is 6. So what you get out of this ratio is 6. So this grid is going to be 6 to 1. 6 what? 6 lines, 6 lead lines per centimeter. Okay. Are we good?
Centimeter?
Centimeter. Centimeter. Even though they're using it's centimeter, just put centimeter. Centimeter. All right. Okay, now, are we okay with grid ratio? Everybody understand? Pretty simple?
Yeah.
Okay, good. All right. Now, let's take a look at something else, and that is called grid frequency. All right, the number of leaded strips per inch or centimeter. How many of the lead strips, how many of these guys do you place in an inch or centimeter? Okay, that's what this is. Okay. All right, the frequency can range from about 60 lines per inch, which is equivalent to 25 to 80 lines per centimeter. Okay, now think about it. As those of you who, let's see, a centimeter is about in a space from here to here. Okay, that's a centimeter. Okay, I don't know what is it, inch, 1/8 of an inch or whatever. That is space. Now, in this space, you're gonna squeeze. Just think about it. You're gonna squeeze 80 lines, 80 lead strips. Okay, so does it give you an idea how difficult this thing is to manufacture? Okay, so they are very difficult to manufacture. That's why they are so expensive. All right. So now, why do you want to change the grid frequency? Okay. The reason why you want to change the grid frequency is because there is more, the more lines, the thinner and more lines you have, but especially the thinner the lines are, the less chance of having grid lines. So high frequency grids, you don't hardly see lines anymore. Remember, the problem with that I had described before is that this is lead, okay? And the thicker it is, the more obvious the grid lines are going to be. And so you want grids that have a high ratio, but obviously they become very expensive. Very expensive. And so now, let me show you this. This is going to be confusing sometimes. Just because you're changing the grid frequency doesn't mean that you're changing the grid ratio. Okay? For example, here, take a look. Both grids here are 10:1 ratio grid. Okay? Both of them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8. There's you'll have 10. Okay? Just imagine there are 10. But what they do, all right, what they do is, once again, the idea is to make them thinner. Okay? It comes out to be the same because when you measure the space here, it should be the same. It comes out to be 10:1s. Are you following me?
Yeah, no.
Okay. What is it? You tell me. What is? How do you get grid ratio?
Height of the
H over D,
grid
right?
over
H over D.
the-
And so if you change this, okay, that's going to change your ratio. Okay. Or if you change the height. In this case, they're both 10:1. Okay. But in this case, they made the lines thinner. The advantage of this grid is that you will see less grid lines. Okay? That's the whole thing. So that's what grid frequency is telling you. Grid frequency is telling you how many lines you have squeezed within a space, whatever, inch or centimeter. Okay? Grid ratio is telling you, okay, how much absorbance of a scatter radiation you have. Two different concepts. Okay, let me repeat it. Okay, grid ratio is telling you how much scatter radiation you can absorb. Grid frequency is telling you that you're going to see less grid lines. All right, a few more things. If you want to find Okay, if grid frequency is what they ask you to find, then this is the way you do it. All right, this is the formula: 10,000 micrometers per centimeter divided by the T is the thickness of the grid line itself. D, I told you before, is the interspace material. Okay, and micrometer line per pair. Okay, so this is how it's going to be presented. Okay, and that gives you the grid frequency. So I think Bhushan has a couple examples, so take a look at it. Very, very easy. Okay, what is this 10,000 micrometers? Equivalent to what? Per centimeter. Okay.
How many lead lines are in one segment?
Exactly. Okay, and that's what you're going to get. So now, in general, higher frequency grids have thinner lead lines. I told you that before. Grids with high frequency show less distinct lines. I told you that before. The use of high frequency grids require use of higher radiographic technique and results in a higher patient radiation dose. So in both cases, the higher the ratio or the higher the grid frequency, in both cases you have to increase big technical factors.
So it's kind of like a direct proportionality.
I don't want to say it's direct or not.
Or directly related.
Maybe directly related, yeah, but proportional, no.
Okay.
But in both cases, if you increase the ratio, if you increase the frequency, you're going to typically increase, and listen what I'm saying, and underline that typical. Because you could also create grids that have a high ratio grid with low frequency, or vice versa. Okay? Think about it. You can create high frequency grids with low ratios. Okay? So it's you know, you can create it in many different ways. Okay? Now, also, very high frequency grids, they can be, you know, you can have from 41 to 80 lines per centimeter. Okay? If you're using a digital system, it is recommended, highly recommended, that you use high frequency grids. Okay? High frequency grids meaning at least 60 lines per centimeter. Write that down, that's important. At least 60 lines per centimeter when you're using a digital system. If the grid are not at least 60 lines per centimeters, you end up with a problem. Okay? When you process, especially with CR, when you process in CR, a lot of times you will see something called a defect, a problem called the Moray effect. And we'll talk more about the Moray effect later, but I just want to mention it to you. It's called the Moray effect, in which you end up with really weird patterns on your image, because a lot of times when you're scanning, when your laser is scanning, okay, if the grid lines are not thin enough, it can grab two lines, and so you end up with, you can look at it in, I think Carlton talks about the Moray effect. It's a real problem where you end up not with grid lines, but you end up with these shades. Hard for me to describe it, but one area will look right here. If this is your image, a lot of times you will see lines going like this on your image. All right, that's the Moray effect.
Okay.
Kind of like that. All right, let's take a break. I need a break. I need a 10-minute break.